Hi, I'm Caitlin and I will be showing you the CVC dressing change today. So first of all, you want to go into your patient's room. You're going to just reveal the site and you're going to palpate the area, noticing if there's any abnormalities or pain that the patient experiences. And then also, after this, that's when you're going to apply your mask. And then I'm going to set up your sterile field. This is always a tricky one because they like to float all over in the packaging. Likes to float around in there, so you have to be very careful. And if you see over there, it kind of came off the edge. If this were a real patient, you would get a new one, but because it's demonstration purposes, I'm just going to pretend like that never happened, and it's all good. Take our sterile gloves. Alrighty, I'll leave that there. Alright. Next, you're going to come over to the patient. You're going to just loosen this tegaderm because it's harder to do when you have gloves on. Okay, and also at this time, before you uncover that site, you need to turn your patient's head. Hello. Because you don't want them to breathe onto it while you're cleaning it. Now I want to apply my gloves. And it's just normal, non-sterile gloves. Alrighty, now I'm going to remove the dressing. Whoops. From this side. And now you're going to notice the site. You want to notice any abnormalities, if there's any reddened areas, any discharge. And you also want to look at the dressing itself and notice anything for like temperature differences, any appearances, if there's different colors on there with the discharge, and also if you can smell any weird odors, because you would want to document that later. And then also, since I'm here, I'm going to remove this tape. And you're going to remove your gloves and discard them. And this time I'm going to wash my hands. Okay, at this point I'm going to put on the sterile gloves. Using the sterile technique. Next, you're going to take the ChloraPrep and you're going to break it away from the patient, not shining it or putting it in anybody's face. Just loosen that up. And you're just going to clean the area with friction. And you'll raise that with your pinky. So you can get the whole site cleaned. I'm going to throw the ChloraPrep away. You're just going to let the area dry so that the Tegaderm can adhere to it properly, always keeping an eye on your sterile field. So we gotta let it dry. So from here we can go on. We can apply the 4x4 just right over the site, just like that. Always remembering again that your pinky is not sterile. And you also want this bendable part to go up by the connector so it's able to close around it good enough. It's not quite dry, but we'll give it a shot. So you want to make sure it's all decent there. And again, you want to make sure the chloroform dries so that this sticks properly. And you're just going to get a piece of tape ready. You can take those wiring tubes down. Just keep them out of the patient's way. Alrighty, now I'm going to just remove my gloves. Since we're all done with the procedure. Next, you just want to document on this little strip that comes with the Tegaderm. You want to document the date and the time. And you also want to initial it so that other staff are aware. And you're just going to place that right there so that the staff can see it. Alrighty, and then I'm going to clean up all of my mess. And then also wash my hands. Always important to remember to keep your hands clean. I'm just going to reposition the patient. Make sure they stay comfortable and safe, because you want to make sure they're well taken care of. Keep them covered. And then pull the blankets out, make sure they're warm. And then after you're done, you want to document the date, the time, the procedure completed, any abnormalities that you saw, how the patient tolerated the procedure. Again, you're going to chart anything that you saw in that 2x2 dressing, any discharge or odor or color. And then after that, you should be all set to complete your next nursing task. Thank you.